today's video is about a very common skin problem that is known as scabies. It's a contagious disease and it's an itchy skin condition caused by a tiny burrowing mite called Sarcoptes scabiei. This causes intense itching which occurs in the area where the mite burrows. The urge to scratch may be especially strong at night. This is a contagious disease, as I told you in the beginning, and this can spread very quickly through close physical contact in a family, child care groups, school classes, nursing homes, or prison. This is so contagious that usually we recommend treatment for entire family or contact groups. The fortunate thing is that it can be readily treated. Medication applied to your skin kills the mites that cause scabies and their eggs, but you might still have some itching for several weeks after treatment. Now let's discuss some of the symptoms due to scabies. First of all, it causes severe itching, which is worse at night, and the irregular burrow tracks made up of tiny blisters or bumps on your skin appear. The burrows or tracks typically appear in folds of the skin. They almost in fact, any part of the body. In adults and older children, scabies is most often found between the fingers, in the armpits, around the waist, along the inside of the wrist, on the inner side of the elbows, on the soles of the feet, around the breast, around the male genital area, on the buttocks, on the knees. In infants and young children, common sites of infestation usually include the scalp area, palms of the hand, and soles of the feet. If you have had the scabies before, signs and symptoms may develop within a few days of exposure. If you have never had scabies, it can take as long as 6 weeks for signs and symptoms to begin. You can still spread scabies even if you don't have any signs or symptoms yet. Now, it's very important that you should see the doctor because there are so many other conditions such as dermatitis or eczema, which are also associated with itching and small bumps on the skin. Doctor can help you determine the exact reason and ensure that you receive proper treatment. Taking bath and over-the-counter preparation may ease itching, but they won't eliminate scabies. So you should be very careful because if the scabies mite is not eliminated, it can recur. Now let's discuss the causes of scabies. As I told you, this is this scabies is caused by a female mite known as Sarcoptes scabiei. This is a 8-legged mite that causes scabies, and this can be easily seen in a microscope. This buries just beneath your skin and makes a tunnel where it deposits eggs. The eggs hatch and the mite larvae work their way to the surface of your skin where they mature and can spread to other areas of your skin or to the skins of other people. The itching of scabies results from your body's allergic reaction to the mites, their eggs, and their waste. Close physical contact and less often the sharing of clothing or bedding with the infected person can spread the mites. Animals and humans all are affected by their own distinct species of mites. Each species prefers one specific type of host and doesn't live long away from that preferred host. Humans may have a temporary skin reaction from contact with the animal scabies mite, but people are unlikely to develop full-blown scabies from this source as they might from contact with the human scabies mite. Now let's discuss some of the complications of this problem. Vigorous scratching can break your skin and allow a secondary bacterial infection such as impetigo. What's impetigo? Let me tell you, it's a superficial infection of the skin that is caused most often by staphylococcal bacteria or occasionally by streptococcus. There's another severe form of scabies called crusted scabies that may infect certain high-risk groups, which include people with chronic health conditions that weaken the immune system such as HIV or chronic leukemia, people who are very ill such as people in hospitals or nursing facilities, older people in nursing homes. The clustered scabies is also known as Norwegian scabies. This tends to make skin crusty and scaly and affects large areas of the body. It's very contagious and can be hard to treat. Normally, someone with scabies has about 10 to 15 mites. In contrast, someone with crusted scabies may be infested with millions of mites. Now let's discuss some of the preventive measures. First of all, you need to clean all clothes and linens. You should use hot soapy water to wash all clothing, towels and bedding used within 3 days before beginning treatment. Dry with high heat, dry clean item you can't wash at home. Then the second method is you should stop the mites. Consider placing item you can't wash in a sealed plastic bag and leaving it in an out-of-the-way place such as in your garage for a couple of weeks. Mites usually die after a few days without food. Now coming to the diagnosis, when the patient comes to us, we examine your skin. We look for the signs of mite, including the characteristic burrows. When we examine, when we locate the mite burrow, we take a scraping from the area of your skin to examine under a microscope. The microscopic examination can determine the presence of mites or their eggs. As you can see in the slide which is shown in the video, this has a very characteristic appearance. Now let's shed some light on the treatment of scabies. This involves eliminating the infestation with medication. Several creams and lotions are available with the doctor's prescription. We usually ask you to apply the medication onto your whole body from the neck down and leave the medication on for at least 8 to 10 hours. Some treatment requires secondary application and treatment need to be repeated if new burrows and a rash appear. Because this spreads so easily, so we usually recommend treatment for all household members and other close contacts, even if they show no signs of scabies infestation. Now let's discuss some of the medicine which are available to treat scabies. One famous medicine which is very effective is permethrin cream. This is a topical cream that contains chemical that kills scabies, mites and their eggs. It's generally considered very safe for adults, pregnant women and children ages 2 months and older. And there is another treatment which is known as linden lotion. This medication, this is also a chemical treatment. This is recommended only for people who can't tolerate other approved treatments or for whom other treatment didn't work. This medication is not safe for children younger than 10 years and the women who are pregnant or nursing, or anyone who weighs less than 50 kilograms should not use this linden lotion. The third treatment is known as crotamyton. This comes with the name of Urex. This medication is available as a lotion or a cream. It's applied once a day for 2 days. The safety of this medication has not been established in children, adults over 65, and women who are pregnant or nursing. And there is a frequent treatment failure with this medicine. So generally, we usually don't recommend this one. And then we come to the oral treatment. This is a drug known as ivermectin. Sometimes we suggest this oral medication for people with the immunocompromised condition, or people who have Norwegian or crusted scabies, or the people who have failed to respond to the prescription lotions and creams. This is not recommended for women who are pregnant or nursing, or the children who are less than 15 kilograms. Although these all medication kill the mites promptly, but you may find that itching does not stop entirely for several weeks. Sometimes if people don't respond to this lotion and cream, we usually recommend other treatment options like sulfur. We call it sulfur compounded in petrolatum. This is known as sulfur soaps. Now let's discuss some lifestyle and home remedies. You need to remember that itching may persist for some time after you apply medication to kill the mites. These steps, I'll tell you some steps which can help you get relief from itching. First of all, you need to cool and soak your skin. Soaking in a cool water on an oatmeal bath or applying a cool wet washcloth to irritated areas of your skin may minimize itching. Secondly, you can apply soothing lotion. There is a lotion very famous, it's known as calamine, that is available even without a prescription. This effectively relieves the mild pain if you are having that, or itching of minor skin irritation. Then sometimes if there is too much itching, we suggest some non-drowsy antihistamine such as claritine. I hope you like this video of mine. If you have any other problem or you want to discuss something with me, you can write in comment sections of your problems. You can discuss your any other issues with me. And if you like this video, please share it with others, because I want to help the humanity regarding all kind of illnesses. This is why I have created this channel. And if you have not yet subscribed, please subscribe the channel and click on the bell button and click on and tick for the all options so that any new video which comes up in this channel, you can get notification as soon as possible. Thank you very much for watching this video.